when we look at how we have managed mental ill health within organizations, is that it often is, if we look at a traditional approach of managing mental ill health, is that we would often have a combination of medication, talk therapy, and social interventions. We would often find that it's provided by primary care providers or specialist mental health care professionals, such as psychiatrists, psychologists, or perhaps social workers. And we would find that that is done within government, community, or private medical facilities if those are available, either through inpatient or outpatient. And there are differing degrees of support provided by national structures. So every country has got its own infrastructure, such as helpline or other support where that is available. And there's different investment from the state or private into such programs. Now, that is typically what we're looking at, but what we're seeing now is that there's several impediments to care. There's a lack of funding, there's still a lack of awareness, there's stigma, and then adequate resources. With the growth of mental health demands, a lot of that model, the traditional model, is not going to cope. The resources are insufficient. There's not enough. There are not enough psychiatrists. There are not enough psychologists for the entire population. So we're needing to think creatively in working together to look at new approaches to addressing mental health care and to addressing that requirement. So here are a few thoughts. I think it's important to incorporate what I mentioned earlier in terms of the global trends. So looking at technology, for example, looking at a multidimensional approach that incorporates all of that. And for example, mobile and online access to resources and support. This is something that we've seen really develop rapidly over COVID-19, that even in environments where perhaps professionals were hesitant to start using telehealth and teletherapy, so using video or chat or other means of accessing care, while there was a hesitation around it during COVID-19, it was the best we could do often. And it has shown to be enormously effective, enormously helpful. Really important for us to create easy access to help and support, so community helplines, emotional chatbots, free apps. What can we do to use and utilize technology to drive that and to support that? What social interventions can we offer that help us to address at a broader scale those risk factors to prevent mental health problems? How can we ensure early identification and triage to appropriate and available treatment options? And important for us to look at awareness campaigns, breaking through stigma, education programs, destigmatizing mental illness, and really making organizations and people aware of their impact, making self-help tools available, and really looking at mental fitness programs. Employee assistance programs and wellness programs can play an important role within organizations. And again, a snippet from South Africa here is that where the public infrastructure was limited, where there was limited access to psychiatrists and psychologists through the public health system, EAPs became an avenue to provide that support as a gap, as really supporting in a collaboration between the public and the private sectors, really offered that support to a large number of individuals and their families. Lastly, in that multidimensional approach is really the referral to affordable quality mental health care, psychiatry, hospitalization, rehabilitation. So we've got to have that. We've got to look at how that plays out. But we need to look at all the other factors and really drive that overall. Now, when we look at ending off, and that's really taking me to the last point of today's topic, and that is really the issue of inequality. And I named this All Things Unequal, and really looking at bridging gaps and creating change. And then these were just some of the thoughts that I wanted to leave you with, looking at the theme of your conference and the context in which you operate, is that I think inequality exists on multiple levels. And that is in the globe in terms of the economies. It exists in academia about which voices are published and heard versus which ones are not. And I think within each country, there will be different inequalities and exclusions and marginalizations that are important to consider. So to address an unequal world and to drive mental health in an unequal world, I really want to applaud you for your focus on local research and finding local solutions. And really for you to continue driving that is really a fantastic achievement and really something where I'm very humbled and proud to be part of today, is that it's important to take those concepts and drive that and finding local solutions that are applicable to your context. And to continue to map systems, to understand the systems that you operate in the broader context of the country and the globe, but also within each organization, understanding what are the subsystems, what are the various levels. Again, going back to a basic concept, the socio-ecological model by Bronfenbrenner, really looking at the various levels from the individual into microsystems, macrosystems, exosystems, as well as chronosystems, to really understand those multiple levels and understanding how they impact on the individual and their mental health. And to then look at interventions that systemically address risk factors and challenges while driving and promoting resilience and protective factors. Again, giving it a positive focus as well, not just a negative one, looking at available resources and driving that. And those were just some of the thoughts that I wanted to leave with you. And that takes me to the end of today's presentation.